All right, Mr. Gibbs. Now I'm going to be doing a complete physical assessment on you.
Okay.
All right, I'm going to start with your head. I'm looking at your skin. You have moist skin, good skin color. I'd like to look at your eyes now, in your eyes. And I'm going to do a nano check at this point. Check your pupils. And at the same time looking in your eyes, looking at the vasculature of your eyes. And everything looks fine there. I'm going to go to your ears, and I see that you, when you had come in, you had hearing aids. And I was wondering if you'd followed up with your doctor regarding the hearing loss.
Yes, we got appointments still coming up and had an MRI and to figure out why I lost the hearing in the left ear.
Okay. All right. So you're being followed for that problem, so that's good. I'm going to go ahead and look into your nose. Look up your nose. Looks like you have a little deviation on the right side and a little bit of redness. Do you have allergies?
Living in Southern California at the spa this morning and riding a motorcycle, yes.
Okay. All right. And do you take medication for your allergies?
Just maybe 3 or 4 times a year when I have a real bad attack.
Okay.
Not usually.
All right. Now I'd like to get into your mouth. Look down your throat. Everything looks good in there. No sores, no redness. Do you have any pain?
Only when I bite my tongue.
Okay. How about swallowing? No problems with swallowing?
That's my problem. I swallow too much. Right?
And your teeth? No pain in your teeth?
Nothing.
Okay, very good. All right, I'm going to go ahead and observe and feel your neck. I'm looking for any areas that are irregular or any possible growths, anything standing out, and everything looks fine. I'm checking your glands. You have glands back here. And tell if you have any infection. They look fine. Looking at your torso here and your shoulders, and you were talking about your shoulder injury. And I see that this shoulder is a little bit lower than your left. All right, at this point, I'm going to continue with my neural assessment. I'd like you to squeeze my fingers. All right, good grips. That means equal strength on both sides. Now for your feet here, I'd like you to go ahead and pull up. Now push down. That's very good. Also showing equal strength on both sides. I'm going to listen to your lungs now and listen to your heart. So I'm just going to have you breathe. Take some deep breaths for me, in and out. Good, again. One more time. Good, your lungs are clear. Now I'm going to listen to your heart. You can breathe normally. And you have good heart tones there. Now, since I'm here, I'm going to go ahead and listen to your stomach. Four quadrants here, and make sure that you have good bowel sounds.
You hear the gurgling?
I do. And you have good mobility, motility in the stomach. All right, that's good there. Now on here, I'm going to look at your back. We were speaking about back problems, so I'm going to just feel down your back. And tell me if any of these areas hurt you, if there's any pain.
No, no pain.
No pain.
No,
All right, I'm going to be pressing back here on your kidney, where your kidneys are. You let me know if there's any pain back there.
Nothing.
Okay, very good. And while I'm here, I'm going to look at your neck. Feel everything's good there. Now back to your stomach. I'm going to go ahead and feel your stomach. Do you feel any pain when I do any of this? No, on both sides? No pain? I'd like to take a look at your fingernails. I'm going to check your fingernail beds. This is looking for at your circulation. We spoke about your being overweight, and one of the risks that come with it is diabetes. And one of the symptoms of diabetes is a high blood sugar. And when you have high blood sugar, it can affect your vasculature. And so I'm just checking to make sure you have good circulation, good vasculature, which I could see in your fingernails and also in your eyes. They looked fine. Now I'd like you to stand up because we spoke about your ears, so I'd be concerned about balance.
Yes, it has affected that, yeah.
Okay. And I'm also want to take a look at your whole musculoskeletal system because you've spoken about injuries on your back, your shoulder, and your knee. So what I'd like you to do right now is to bend over if possible, just without falling over.
Touch
Very
the
good.
floor, okay, I can do that.
Okay, very good. Now come back up. And you did well there. Oh, yeah,
Didn't
looking
pass
pretty
out.
stable. Now I'd like you to do it again for me. I'm going to look at your back this time. Okay. All right. Come back up. I'm looking for symmetry in your back and your hips. Very good. Okay, you can go ahead and sit down again now, please.
Okay.
All right, and we talked about your knee. I can see where the swelling is now.
It's just always that way.
Okay.
It's really bad hurt.
All right, very good. So, do you have any questions for me?
No, I'm just waiting for your miracle solution how I get skinny.
Okay, so everything looks great. You're doing very well for a 72-year-old male. As our last discussion today, I'd like to talk to you about what our plan is, and that being, number one is the weight loss. So I would like you to keep a journal of what you eat, and if you can include the calories, that would be great. And then I'd like you to come back and see me so we can go over that. I'll have the secretary, as we leave, give you some printout on diet and the low-fat diet. There's actually one I would recommend is called a Mediterranean diet, and that seems to work for a lot of people. Low-fat is just, when you say that, people just get
That's where you
leery
drink
of it.
olive oil, right?
There is olive oil. It's very, very natural, very
I like olives.
very fresh diet. But it has the olive oil in it so people don't feel deprived of fats as they would in the low-fat diet. And continue taking your medications. You're on, can you go ahead and tell me what medications you're taking?
The only one that I take that I requested, the doctor didn't sign it first, was the little yellow pill for cholesterol.
Mm-hmm.
What is it called? Cholesterol, what is it?
Okay.
Anyway, then I also take my daily aspirin,
Okay.
vitamin pill, a zinc pill, vitamin D, fish oil, and my
Magnesium.
chloride, 2 tablets.
Okay.
So I'm really not on prescription. The doctor's request, I requested it.
No, and that's very good. You're on a very natural medication regime, and for a lot of people that works, and that's great. Stay away from pharmaceuticals as long as possible.
That's exactly right.
That's very beneficial.
That's it. And all the shots, too.
No shots.
No shots.
Nobody likes shots.
That's right.
All right, so thank you very much for coming today, and if you have any more questions, please follow up with us. Maybe I can see you in a couple of weeks.
Okay.
And also I'll give you, as you're leaving, I'll give you requisitions to get your labs drawn. So I'd like to
Okay.
check your your glucose levels. Yeah, I'm sorry. I'd like to check your glucose level just to make sure, because diabetes is one of the concerns we have. And then please continue to follow up with your doctor regarding the
Okay.
hearing.
Sounds good.
All right. Well, thank you, Mr. Gibbs.
Thank you. Good job there.
All right.